already intubated.
Yep.
So now you are going in to do a tracheostomy.
Yes.
And I would identify my landmark, which is the superior thyroid cartilage, and between the suprasternal notch, somewhere in between, but not too high or not too low. And keep in the midline so that it's easier to cut through with minimal bleeding. I'll prep, I'll drape, I'll set the scene. I'll go with my 15-10 blade and do a midline incision to the skin, and after that I will I'll take my Langenmark through the skin, and over here I'll give it to my assistant to hold on to it, please. Take the medicine bomb, find the midline, go through it and cut it, spread it, do blunt dissection. Then I will see the muscles, the red part of the muscles. I will try to go through the midline, through the raphe. I'll go and make an incision, a blunt dissection, and spread it apart. And I will shift to the larger ones.
I'm going to pretend this is a larger one as well.
Okay. That's the larger one. Now I can see the thyroid and the rings, the tracheal rings and the space between them. Now I will ask my anesthetist to decuff the ET tube.
Some rescue sutures.
Okay, and do the rescue sutures.
Reconnect that.
So your cuff is deflated.
I'm going to do the stay sutures now. Okay, you cannot do through it, but
Yeah. Or you can go under. You can actually go into the white bit.
the white bit.
Yeah.
Okay.
Because it's not realistic. You just go into the white bit.
Yeah, just.
Yeah. That's it.
No, go ahead. No, I've done it. Leave it.
Yeah. It's okay. Okay. So you can just tie it off. So.
First you loose ties.
How many throws should we make for the stay suture? Like 2 reef knots? So
Yeah, like it's
Loose ties.
It's nice just to put a little knot in it, just because it doesn't pull through. But you can do it like this as
Do
well.
like tying?
Oh, tie.
Yeah,
Okay.
It's okay. I don't think it's a critical point, you know. But you get the. If you want to do a knot, you can. We'll test your tying skills at this stage. It's not bad. Have you done much of this? You have.
Yeah.
It's good.
and we are making a hole, and
I'll leave on
we are not
to
Yeah.
putting
here.
through the edge of the. We are not slipping.
Yeah,
down
yeah.
out
So,
of
the loop stays out of the skin, so it's easier to cut on the ward. So again now,
Put another stay suture.
another suture through.
And during that stay suture, the endotracheal tube always keeping deflated, or do we need to inflate the cuff
So
between the break?
between them, I would inflate because there's going to be a minute before you're able, and it's good to give some respiration period because when the cuff is down, it's ineffective. It's compromised. So now you've got 2 rescue
Stay
sutures in.
Yeah.
It's great. So you're talking to your anaesthetist again.
To decuff the ET tube and to start pulling it slowly.
Yeah. So first thing is really just to deflate the
Deflate the cuff.
cuff. Okay. And now you're going to incise in. You know that your balloon is going to be somewhere around here.
Okay.
Because usually the ET tube is down a few inches away, or an inch away from the carina, the tip is.
Yes.
The balloon is above that. So it's never really going to be up here, you'd hope,
Okay.
if the tube is long enough. So you know that deflating the cuff and then cutting it.
So I'll just ask the anesthetist to deflate the cuff, that's all. Not to pull yet.
Initially it's just deflate cuff.
And then I'll make the incision through the trachea.
Yeah. and then you get a lot of. This is where you get all the
Air.
back pressure and air splurting back to you, and then you get your tracheal dilator.
I'll go in.
And then you try and get in there. Yeah, you spread it. That's great.
Yeah.
So
I
you
can
got
see
a
mine.
nice. Yeah. Now you're talking to anaesthetist.
To start pulling back slowly
Yeah.
until I can see the decuffed balloon.
Yeah.
And as it goes up a little bit more, I can see the bevel and ask him to stop it right above.
Yes.
Yeah. And after that, I will.
Yeah. So they hold that position just until you're happy.
Yeah.
You've got your tube lubricated.
Before the procedure, I'll make sure the cuff is.
So you've
actually
checked.
working.
You've
Yeah, it's
checked
checked and all
everything.
done.
Make sure. Yeah.
Where's the switch? No, it's not too good. No, you don't need to dilate anymore. Right? You can just go in.
No, you probably will actually because it tends to close up. So what you're doing is you have that in. Yeah, in one hand and you're open it. Yeah, that's it. And now you slot it in there, okay? So twist and insert. That's it. And just go gently with it. And it's not real in this situation. So now tube is in.
Tube is in.
Yeah.
Take
out the introducer. You're connecting up the anesthetic tube. So this way you put the connector on.
Okay.
Is there somewhere? No, that's not it. Is that it? Yeah, that is it. Okay. And now you inflate your balloon. You're getting an assistant to hold this down.
Please hold it.
Yeah. And then once you got a few mils of air in there. Great. So that should hold it in place now. Reconnect all the circuit.
The circuit is
Yeah.
connected.
And now you ask the anaesthetist to check their CO2 levels.
The entitles you.
Yeah. So they're able to tell you, yeah, that looks good, that looks good. And then you check your balloon to make sure it's still holding pressure, so it hasn't ruptured.
Okay.
And once everyone's happy, then you can start taking it off. Okay? And then suture, if that's what you want to do, or you can do the neck cuff as well.
Neck cuff, okay.